Hi, I'm Gabriella Howland, and this is our physical therapy info interview with Alan, Sophia, and Sergio. What exactly is physical therapy? It is essentially a profession that treats for recovery from injuries, deformities, diseases, and post-surgery. It is actually a very holistic approach compared to using medication or even surgery if there's another alternate solution. Some things we should know about is the average workload, which is around 40 to 50 hours a week, which is around 8 hours a day. It varies by each person, and it's around 5 days a week from Monday to Friday, some due to weekends. As for the average pay, it starts at about 60.5K and can go upwards to around 130.2K, which is around $44 an hour. To our good old friend and interviewee, Richard Aridelis. This man is 57 years old, has been in the field for about 30 odd years, and works at ATI Physical Therapy. He started off at his local community college in Corpus Christi and wanted to go into pharmaceutics with a degree in biology. As he went into the subject, he found physical therapy and found that more appealing. Since it didn't work with blood, he didn't have to sit at a desk all day, and he got to stay active. So he went to Texas State, obtained his bachelor's, and then marketed himself and got himself into a PT program at Texas State where he got his master's. Once he did that, he did various small jobs around San Antonio, including working in the hospital and home care, and eventually found his permanent home at ATI Physical Therapy. One typically prepare for a day of PT? Well, we start around 6 in the morning. We wake up and get ready to go to work. We open up at around 7, get everything prepared and equipped. Usually make sure any equipment we need is set up for any appointments later on at around 7:30. At 8 o'clock is when we typically see our first patient. And from 9 to 5:30 is when we usually get other appointments or walk-ins, which usually finishes at around 6:30 p.m. Up until 7 p.m. we usually clean out anything we need to sort out, and then close, finish any closing procedures, and can head home for the day. Some important thing to note is some days outside of the usual work schedule will include working at home or sorting out and coming over the weekends if needed be.
Hi, I'm Alan, and some common problems that physical therapists have to go through with patients. There's never a real problem with the patient itself, but rather the issue with payments, more like insurance and building a plan that works with the budget. And with staff, simple issues of supply and demand with our staff, and a full schedule. Other positions seen in this workplace are assistants that aid in patient care, typically under a physical therapist or on their own. You can also see technicians, which focus on patient care under supervision of a physical therapist. And then admin, which are those that help you out in the front and help you handle the payments and schedule appointments for you. Competitive in the PT program, PT schools have an average of a 10% acceptance rate, so it's pretty difficult to get into it when they're only accepting a few students out of thousands that apply. Many programs require you to take the GRE exam, so it's important to do well in it, and it can be an important factor if you get into a school or not. And PT is a very competitive field, as it is rapidly growing throughout the United States. Some helpful skills to be a good physical therapist are stamina, sustaining prolonged physical and mental effort, as you have to stand up and help your patient exercise and do the correct exercises. Good communication, getting necessary points across efficiently with the patient. And then detail orientation, noticing important details to make the process more effective. And you also need good time management, using both yourself and others' times productively. A few words of advice. Competitive field and will require sacrifice. Thousands want the same thing as you, so be honest, both with yourself and to those interviewing you.